Chapter 8, Video 4. Today we're going to talk about paroxysmal atrial tachycardia. This is also referred to as PAT, you will see here. Paroxysmal atrial tachycardia is a sudden burst of 3 or more PACs in a row. So it's a sudden burst of 3 or more premature atrial complexes in a row, okay? What happens is these PACs usurp, they take over that underlying rhythm, and then it becomes its own rhythm for a period of time. Okay, so remember with the PAC, we just have that premature atrial contraction on top of whatever rhythm we have, whether it be a sinus rhythm or whatever. But what happens when these PACs, they come in, they take over, they create their own rhythm, and that's what we're talking about here. They create this PAT, this paroxysmal atrial tachycardia. Paroxysmal atrial tachycardia, PAT, it resembles sinus tach, but it has a much faster heart rate, okay? One thing that's very important that you guys need to remember, when we are diagnosing paroxysmal atrial tachycardia, in order to make this diagnosis, the premature atrial contraction that originates, that starts this beat, you must see it, okay? If you cannot see those premature atrial contractions, then it is not PAT. It is not paroxysmal atrial tachycardia, okay? The term paroxysmal refers to a rhythm that starts and stops suddenly. Okay, so when we see paroxysmal, that means we're talking about a rhythm that starts and stops suddenly. PAT, P-A-T, is paroxysmal atrial tachycardia, and it resembles sinus tachycardia, but with a much faster heart rate. Moving on to the next slide. This is your criteria, okay? The rate is 160 to 250 on the atrial tachycardia itself. The rhythm that it interrupts, the rhythm that it takes over will be different, okay? So the underlying rhythm will be different, but the atrial tachycardia itself, that rate will be 160 to 250. Regularity, atrial tachycardia is regular, but because it interrupts another rhythm, the rhythm strip as a whole will be regular, but it will be interrupted, okay? So atrial tach is regular, but because it interrupts another rhythm, the rhythm strip as a whole will be regular but interrupted, okay? Those PACs come in and they interrupt that rhythm. The P waves, these are different from sinus Ps. The atrial tachycardia P will be shaped the same as each other, but it will be different from the sinus P wave, okay? So that sinus P wave, when that rhythm is originating in the sinus node, you'll see the sinus P. But when the PACs come in, they take over and you see paroxysmal atrial tachycardia, you'll see those P waves change, and they'll be their own P waves because they're coming from a different area. In atrial tachycardia, abnormal P waves precede the regular QRS complexes. So one thing you'll see is you'll see those regular QRS complexes. Now here's our PR interval, 0.12 to 0.20. The QRS is 0.1 less than 0.12 seconds, and the cause is the same as the premature atrial complex. The adverse effects associated with paroxysmal atrial tachycardia would be decreased cardiac output. We see decreased cardiac output when we have prolonged periods of the PAT. Remember, paroxysmal means starting and stopping suddenly. So with PAT, they may bounce in it for a minute and then they may come out of it. But if it happens for a long time, we can see some cardiac output with the prolonged runs. The treatment is going to be digitalis, calcium channel blockers, beta blockers, sedation, amiodarone, oxygen, elective cardioversion in patients who are unstable. Cardioversion, we're going to talk about this later, but cardioversion is when they shock the patient, but they shock them, they watch the rhythm strip and they shock them at a certain time, and it puts that heart back in rhythm. Cardioversion is different from defibrillation. Defibrillation, we have a little bit of electrical activity, but it's chaotic. You just put the pads on them. You get everybody to stand clear and shock. You just deliver that shock as quick as you can to get that heart back going. Whereas with cardioversion, the heart's working, and you have to deliver it at a certain time in that cycle. Amiodarone helps abolish the atrial and ventricular rhythms. Adenosine is another medication that slows the heart rate. And again, cardioversion is that electrical shock that's given in a synchronized manner. They'll do this cardioversion if the patient is unstable because of the rhythm, okay? Healthy people can tolerate the rhythm for a while without symptoms, but those with heart disease, they may develop symptoms faster when they're experiencing PAT. In order to diagnose PAT, again, the PAC that initiates PAT must be seen. PAT is simply a run of 3 or more PACs together, and the T wave that changes shape when the QRS don't is hiding a P wave inside of it. So the same rules as diagnosing a PAC, but we just have more happening. So let's take a look at this. We've got to go through the 5 questions of diagnosing a strip. Anytime a strip comes up on the screen, you ask yourself those series of questions, okay? So question number 1, QRS complexes. Do we have QRS complexes? QRS complexes are present. They're all the same shape, okay? So we do have QRS complexes, and they look normal. Regularity is regular, but it's interrupted by a run of premature beats that you see right here. The heart rate is 75 for the sinus rhythm, and it's 187 for the atrial tachycardia. Remember, we're going to count these little blocks in between the R and the R and divide by 1500. So here it would be 75, and then when we go over here, we would have a rate of 187. The P wave precedes the QRS complexes, but they're not all the same shape. So let's go P, QRS, T, P, QRS, T, P, QRS, T. Okay, then we get here. This one looks the same QRS, but whoa, we don't even see one here because it's hiding in this T wave. They're coming in early and it's distorting that T wave. So this is where these are different, okay? The sinus beats have one shape of P, which you see here in the sinus beat. And the atrial tachycardia has a different shape that is actually deforming this T wave that you see here. You can look at these dots. These dots are over the P waves. Remember, these P's are hiding in the T's, so that T looks distorted. Remember, a T wave that changes when the QRS does not is hiding a P wave, okay? So this is an example of paroxysmal atrial tachycardia because we can see the PAT right here because the P wave is hiding in these T waves. If you have any questions about this, please let me know.